guys. Good afternoon. I hope everybody had a wonderful lunch. We are going to go ahead and get started, as I know more people are making their way back in, finishing their drinks, all that great stuff. We want to keep everybody on schedule for their awards and networking, all that great stuff. So without further ado, let's start our next panel. This next panel discussion, Healthcare Disrupted, How AI and Digital Health Are Transforming Tertiary Care. Please correct me if I said that word wrong. I'm going to bring up our moderator to lead the proceedings. Can I please have Dr. Wendy Ringo come to the stage, Chief of Medical Affairs from Sciometrix. Round of applause.
Good afternoon, everyone. I would like to welcome our panelists up as we get started with this section of our discussion this afternoon. I know it's a hard act to follow after lunch, but we will definitely do our best. My name is Dr. Wendy Ringo, as she mentioned. I'm with Sciometrix out of Royal Oak, Michigan. We are a digital healthcare organization, primarily interfacing on the primary health care side, CCM or CCM and remote physiologic management is what we particularly cater to at this time. We also work with nephrologists and cardiologists with some of the wearables and digital devices. So we are very adept in this space. So without further ado, I'd like to introduce my esteemed panel members here to help further this discussion about the disruption of healthcare as it relates to AI and digital health and how it has impacted tertiary healthcare. So without further ado, I'd like to start with the first esteemed panelist. And for the interest of time and also so that I won't mess up anybody's name, I will allow them to introduce themselves.
Excellent. Thank you so much. My name is Regina Atim. I am the founder and CEO of Clinicians Touch Healthcare Solutions. And at Clinicians Touch, we primarily work on human factors and health safety solutions for both industry and hospital systems alike.
Okay.
Thank you. My name is Subha, Ramiah. Thanks for joining today. And my background is in technology, digital health, and in healthcare organizations in the past 30 years. My undergrad is engineering, graduate school, computer science, and I've been in the industry for about 30 years in 5 sectors, the last 15 years in healthcare. My passion is driving better health outcome using digital health technology. I've worked for Cigna and Anthem in the last 15 years. And the overall aspect of this topic, I believe, what we're here to talk about is how AI and digital health and technology drives the change in tertiary care. So I'm not a doctor. I don't play one on TV. I'm among the esteemed panelists of 2 other physicians. And thank you.
Hi, I'm Faviola. Is my mic on?
I think so.
All right. There we go. I'm Faviola Brugger-Dadis. I am here all the way from Amsterdam, you guys. I am with NeuroReality. I'm the founder and chief innovation officer. NeuroReality is a VR-based telerehabilitation solution, and we primarily focus on acquired brain injuries, so anything from stroke to concussion to individuals who have had an accident. But during the pandemic, we saw a great amount of growth in other different user cases. So we combine a really powerful way to gamify and make this type of rehabilitation a lot more fun by harnessing neuroscientific principles and neuroplasticity, the ability of your brain to regenerate and grow past the point of having had an injury. And we utilize the combination, I think the microphone keeps going off, doesn't it?
Go ahead.
We utilize the combination of neuroscientific principles as well as smart algorithms, supervised machine learning, and we're capable of remotely monitoring or utilizing the solution in healthcare facility. So that's a little bit about ourselves, and then I think we'll get more into all that.
Thank you.
Well, thank you for sharing. With that being said, I know there are so many different directions we can go in when we start to talk about tertiary care. So how about if someone would do me the pleasure, if we're talking about tertiary, how about primary or secondary care? If we're talking about the disruption or how digital healthcare or AI is impacting on tertiary, can we first go back to define primary, secondary, tertiary?
So I would say that the AI and digital medicine has definitely disrupted the field and put more of the ownership of the healthcare on not only the patient, but also their caregiver. So it's allowed for them to interact a little bit more with one another and to really have more real-time results and real-time discussions about their health and to really help the end user to feel a little bit more ownership and a little bit more, I would say, understanding and have a lot more information really at their, for them to be able to just see, with the use of their phone, any sort of information that they may need from their physician. So the communication channels have definitely been opened more. And so I think there's a lot more to be done, but the information is definitely there.
Yeah, I think the definition, right, why we determine primary, secondary, and tertiary care, as I said, I'm not a doctor, but I have a family full of doctors, 58 of them. So primary care is when, people, when we cough, we have an infection, we go see our doctor, medication is given, and then we are healed. And then in secondary care, where a complexity becomes a consultancy for a specialty, like a, deep chronic disease, heart condition, diabetes condition, or chronic diseases. So that becomes a secondary care. In the tertiary care, it becomes very super specialty, like neuroscience, for one good example. Also in cancer treatment and other oncology and genetic-based diseases and so forth. I think that's the way we differentiate primary, secondary, and tertiary care in general. Tertiary care becomes very complex because it has to be coordinated with all the different primary and secondary physicians to coordinate a welcome. So I think that's the way I see it, tertiary care. Where the technology plays a major role is that all the primary physicians who are caring for the patient, for the condition, are disconnected everywhere. So the digital health and AI in the history helps to drive a data unification and learning about that patient from that perspective. So I think the concept of how AI and digital health drives the tertiary care is on affordability and access. I think that's a stage we can further discuss.
I think as well it also helps with continuity of care, which is something that's very important. And you often see patients that go through their treatment modalities, but as we've been discussing a lot at this conference in general, that doesn't necessarily lead to outcomes. Treatment is not outcomes. Mm-hmm. So tertiary care, as you said, it's such a broad definition, and tertiary care also includes a lot of individuals who don't have access to healthcare facilities close by. So some people will also define tertiary care as a facility that is approximately 2 hours away from where you would actually be receiving your care. And for me, that was sort of a huge inspiration in creating NeuroReality and founding NeuroReality, because my grandmother, she passed away from a stroke, but this was completely unnecessary. She lived in Kamloops, which is in British Columbia, a rural area, and for her, the catchment area of the hospital that was served was about 25,000 kilometers squared. So, that way, if she needed any type of specialized care, she had to go all the way to Vancouver, and a 3-hour trip to Vancouver, a 3-hour trip back for someone that is suffering from a stroke. She had, of course, her first stroke and then subsequently, unfortunately, passed away from another large stroke. But if we had been able to give her this type of opportunity and have this type of tertiary care and the consistency during the whole process, let's say, of her trajectory into learning to deal with this new reality of her life, I think that that would have been fantastic, because digital health allows you to not only look at your patients while they're in the office, but also to monitor them and help with diagnostics when they're at home, in the comfort of their own home.
I think that's the best point right there. Surely it does help for and make for better analytics overall. And as you mentioned, the monitoring even when they're at home. So if we're talking about wearables, if we're discussing, 5G devices, so that real-time information can be relayed and action can be taken in, again, real time. So key points to that end. But what I'm most interested in, if we're talking about how it's really disrupting or changing tertiary care, I know you guys represent various backgrounds. We have pharmacy here, we have tech, and we have innovation with tech here on the end. How would you say that AI and or digital health or digital monitoring is impacting your specific areas of healthcare?
Yes, great question. So I still believe that the continuity of care issue is something that is being definitely impacted by AI and digital medicine advances. And an example is maternal mortality, for example, which we know is a huge issue currently and was worsened with the pandemic. If you have wearables and if you have digital monitoring solutions, that's something that I think could make a huge impact in maternal mortality. For example, monitoring the patient while they're at home, as you'd mentioned, after a condition, or while they're awaiting their delivery date, and postpartum as well, because we know that for maternal mortality, a lot of those fatalities occur after birth. So I think, that's one example of where, this care, this digital medicine and advances could be utilized to advance care.
Yeah, I think the point I was going to add to that is that in the past, the last 30, 40 years, if you see, the technology evolved to where it's possible today that a physician, no matter where they are, could get the typical vitals on a continuous basis.
Yes.
Of the complex patient, no matter where they are. So, for example, like I'm wearing a clinical device watch here. This is currently providing about 15 different vitals live continuously, so that the physician who's monitoring in the back can actually see the trend. So the data of how the historical vital signs have grown, are gone down, are better for the outcome, can be actually measured, right? So the idea behind that is this: the technology has driven us to today's point where these things are possible, where a vital sign, like I mentioned 15 different vital signs, those are even not available in the ICU, but with a watch and a patch, the doctors can actually get a historical data. So that data feeding in, and then you had earlier sessions, so 2 or 3 sessions there, they talked about data, interoperability, and then the data history, and longitudinal patient record, right? So all these data is coming in, and with the advancement in technology, now the AI can actually see a 2 to 3, 4-year trend of all the vital signs. And then that's, I think, is the change which the digital health provides for tertiary care.
So I'll elaborate on the data part of that. I know that people are very concerned, medical data and the storage thereof, but at NeuroReality, we're capable of collecting about 10,000 data points that lead us to understand the disease state of our patients, and we specifically focus on cognitive deficits, which are generally left untreated, and in oncology all the way to, even dialysis, kidney dialysis, but we work primarily, with brain injury patients. And in that way, we can consistently monitor what is happening with our patients. We get that data. We're capable of passing that data on to the clinicians, who then as you mentioned, are capable of providing, because everyone is different. So we need personalized care, we need unique care. Even within a brain injury or a stroke, for example, every person is heterogeneous. So we are utilizing all of these different types of digital health solutions and AI in order to understand our patients better and provide more directed care. Because when you go to a physician or primary or secondary care, you're usually getting just a snapshot of what's happening with your patient. You're not necessarily getting the full picture. And I think that this has been further exacerbated by the pandemic, where we saw that a lot of what they would call non-essential procedures were very essential. And if you are able to utilize digital care and AI to connect with that ability to have continuity with your patient files, with combining this with your primary and secondary care, and that everyone has a holistic approach to this, then we see that there's a lot of possibilities. And I think especially in telehealth, that's really, really where we're noticing these huge things. We collect with our data a lot of normative data from the general population. Excuse me. And with that, what we can do is, with thousands and thousands of healthy individuals, looking at their demographics, we can compare those to individuals and learn more about their disease state and where it is, as I said, that we can focus on. Instead of doing a lot of procedures, doctors are taught, this is the procedure that you offer, this is how it goes. So they might feel that doctors can be a little bit dogmatic. They're amazing, but they were taught to administer care in a specific way for a very long time. So now we're disrupting this industry by bringing in all of these digital solutions and utilizing supervised machine learning and all sorts of things that are involved in AI that are capable of pushing forward our agenda, which is essentially better patient outcomes and better healthcare outcomes.
Thank you for that. So that does lead me to this question then. We've done...
It's a tech conference. We always have difficulties at tech conferences, don't we?
Okay, great. So what would we say, having said all of that, surely does help with the efficiency and the data coagulation and the analytics and operational benefits, but what are some of the challenges you think, either of you, that we are facing with some of our tertiary care models as it pertains to AI and digital?
So I would say that at Clinicians Touch, part of what we've been doing is human factors usability testing on a lot of these digital solutions. And a lot of the issues that we found have been related to the interoperability and the transferability of the data, and having that data be available in real time to the provider, and have that provider be able to process that data and also then, respond. And many times, if this is not a part of their work process, it's something that may be available, but if it's, at what point is it actionable, right? So I think within what I do in human factors, we try to test to see how usable a lot of this information actually is, and how we can make it more usable for all the end users and empower everybody that's involved within that healthcare continuum, so all the way down to the patient. So if the patient is being monitored and they see something that is consistent, perhaps if they have a blood pressure that is out of sync for, say, 3 to 4 or 5 days, right, then they perhaps could then put in a call for their physician and say, hey, I know you're getting these labs, but they may be going to their computer system and may not be alerting the physician, like, hey, this is a high alert now, and you need to take a look at this. So it's just creating a system that allows for it to be smart, right? So that's the AI functionality to say, hey, we've noticed this trend, and now it's gotten to this alarm state, and you need to pay attention to this, and you need to take action. So I think that's right now the constraints that we're seeing in our testing, but hopefully as we go through the testing and going back and forth and working with all our engineers, we can figure out a solution that can help us to get to that point where it's just not information overload.
I would love to jump in there. I think that what's really important that I took from the beginning of what you were talking about is we need to make sure that we fit into the patient journey. And that is very important because the patient journey is where we're going to be able to, let's say, convince these care practitioners that the solutions that we're providing, even though they're disruptive, are not taking away from their jobs. I think a lot of people have this notion that AI is going to take over, maybe in the future, but right now, the way that I see it is an assistive technology where the golden standard is still the clinician. However, with this, we're then able to fit into the patient journey and make sure that all of this information is given to them in real time. At NeuroReality, we have a back end to the product that we created, which is a really great way for not only the patients, but the clinicians to be able to see how they are progressing. And then that takes me back even to my grandmother, where if we had been monitoring her remotely, we would have gotten those alarm signs. And that's a big challenge, is implementing all of these things and having them be accepted. I think that right now people are very interested in this type of actionability in healthcare. However, it's not necessarily that easy to penetrate the market yet. It will become easier, I believe, especially as the pandemic highlighted, but still, I think the most important thing for creators like us is to talk with the patients, talk with clinicians, talk with all of the different caregivers that you're working with, and make sure that the solutions that you're creating are wanted, are necessary, and are actually fitting in with the care continuum that they would provide. Because otherwise, they're not going to adopt our solutions necessarily.
Yeah, and I think I totally agree with you, because the point here is, one is to collect the data, the other one is to make it available to the responsible physicians and the caregivers, and the other one is to feed back to the patient on how they're doing. So in a simple nutshell, when we say digital health, how does it impact health? I would put it in a simple common word term, is that a doctor in my pocket, a nurse in my purse, a therapist in my jacket, a pharmacist in my fingertips, a clinic in my GPS, a lab in my lab, and a hospital at home. If you think about it, this is the concept of digital health. It covers the whole gamut of the entire continuum of healthcare. So that's an easy way to understand how digital health impacts every aspect of it. And I want to point out one example of compliance, right? So if you take tertiary care, let's say a cancer patient and other folks who are taking very expensive drugs, so drugs could cost you as much as $80,000 a month. For compliance is that, how many of you guys know that among the medicines prescribed, how much of them are being picked up from the pharmacy, and then how much of them being consumed by the patient, and then the feedback to the clinician that they are actually consuming the medication as they're done. So the digital health helps to do the compliance aspect of it as well, because typically 30% of the medications prescribed are never picked up, and those who are picked up, 30% are not consumed. So if you think about that concept, the whole area of the doctor in my pocket, nurse in my purse, brings back that digital health. So digital health helps to drive that collection of all those things into a holistic part back to the care team. So I think digital health helps to drive that change. And then from your standpoint, is the usability of devices and technology and so forth, is the human factors part, right?
No, absolutely. And I'm glad you brought up the aspect of medication compliance, because I think that's the core of a lot of the difficulties of, the sequelae of effects that occur with patients. And we've struggled in pharmacy to figure out, how do we ensure that patients take their medications? And I previously did some testing on an application that was testing actually ingestibles, so testing to see, when the patient has taken the medication. And it's not perfect, but I think it's a start. But as you mentioned, digital medicine definitely allows for the communication, at least, even with the pharmacist, for example, and their patient. If they're connected, the pharmacist or their other caregiver can notice that maybe their labs are off. And, if it's something, they can ask the patient, are you taking your medications? And patients are very honest with their pharmacists, more so than they are with other healthcare providers. So usually they'll tell them why. And then the pharmacist could then take that information and maybe notate their chart. But this all, requires the interoperability with the EHR, for example, so that the doctor can see those notes. So this is definitely futuristic, but it's not something that can't be done right away. And it's something that if it was done, you could identify maybe not only that the patient's not taking their medication, but perhaps why. Because they will normally tell you why. They may say, I don't like how it makes me feel, or it gives me constipation, or I'm having these other effects. And if they're speaking about it honestly, perhaps we can then intervene and either add something on if there's no alternative, or exchange that medication for something that works a little bit better to then, ensure that compliance. So absolutely, I appreciate that you brought that up. And again, it shows how disruptive digital medicine and AI can be.
You have about 2,000 cancer drugs on the market. And when a doctor prescribes you a drug in oncology, they just go ahead and they pull from whatever that list is. And perhaps the patient, as you said, is not feeling good about that medication. And while you're already going through and suffering and dealing with a lot of challenges, you're not a doctor yourself. You don't know exactly what to do, and your family as well wants to help, but they don't know what to do. So AI is now making it possible to identify, again, individualization, giving patients autonomy, and then saying, this would be the particularly best medication for you. The way that we do it is completely different. We utilize reward. So with the VR-based software, we've created a prescription game, which is really quite disruptive and new. And we'll get a little alert, the clinicians will, and we'll then remind the patients, hey, you haven't been participating in your program, why? And what we do to incentivize these patients to do so is by making sure that they feel rewarded by what they're doing. I don't know who doesn't like fun and games, so what we did was we combined all of these principles in order to make sure that even while playing a game, we're gathering all of the vitals that we need and the information that we need. It's being analyzed by AI. We treat individuals at a different level. We calibrate to their particular level. So in the beginning, as I said, not everyone is the same. So we'll calibrate it to their level. And then in this neurorehabilitation game that we've created, you are capable, it's called Koji's Quest, and you have a digital companion who is then taking you on the journey with you, making it not so necessary for your clinician to be present with you. And the more you play, the more elements of the game become open, and people really enjoy that. So I think I was really inspired. I was born in the 80s, so I was really inspired by 90s kid video games like Tetris and Pokemon and things that really have withstood the test of time. So what we did was we took a lot of these paradigms and gamified them, and then give people rewards in order to make sure that they're actually complying, because then when you come back to play the game again, you know that you're going to get gems or stars or these little coins that you're going to be able to utilize within the game. And that helps as well with the continuity of care, because in this sense, we're triggering the dopaminergic system, which is our reward system internally, and neurobiologically, we are wired to seek rewards. So if you're providing that type of care, then something small like a virtual assistant in our game, Koji, your little doggy that follows you around and shows you how to take the actions if you're not with your clinician and what to do, you can customize him. You can customize the world, the virtual world. So there's a lot of different things that can really be done in order to make sure that we're achieving these types of outcomes.
Is there something you wanted to add to it?
Yes, I was just going to add that that sounds wonderful, and it's one of the principles that we really push in terms of engaging all of the parties that are involved. And it sounds like your solution is attempting to engage the patient in their own care, and that is something that we test a lot of in human factors when we work with our different clients. It's just we see clients are all trying to figure out a way to engage their end users and empower them to be a part of their solution. So gamifying it or making it a part of their everyday, life is definitely, I think, a good way to promote that and keep them engaged and keep them participating in their own health. So thank you.
Of course, it creates autonomy for these individuals, and everyone wants to feel autonomous after they've suffered from something so drastic as a medical condition that has changed their life.
Absolutely, and you mentioned even, with stroke, so I could definitely see something where in addition to whatever application you're adding, that perhaps you could add something that could be stimulatory maybe to help them to regain some of that function that maybe they had lost, that they can do on their own without necessarily having to go into therapy, or, something that they could manage and do as they feel they need to, right, at home. And I can definitely, see utility also in the mental health sector as well, where, you stimulate the participant to engage in their own health and tell you how they're feeling, how, if the medication is working this way or that way, and monitoring that. And then when they do get, in front of their doctor, they have very specific things to then talk about, and they hopefully would feel that this entire time that the information has been gathered, the doctor has had all of their information at their fingertips, and for the physician, hopefully that gives them the ability to understand what's happening with their patient since they last saw them. If they haven't seen them for 3 months, perhaps they can look at some of the data, some of the documentation that the patients themselves have documented, and then, prior to seeing that patient, read over all of that information and hopefully then come to a meaningful and more accurate conclusion on what's actually happening with their patient.
Well, I'd like to ask, with the time that we have remaining, what does the future look like from the perspectives of each of you as it pertains to AI and digital healthcare?
Maybe I'll just start, and then please join in.
I think that honestly, I'm like, the future of medicine is here.
Yeah.
It's very unfortunate that on the news we get a lot of entertainment, but we don't actually get information unless we partake in these types of conferences or we're experts in our field. So I think that's quite a shame. But if we're making sure that this sort of, we talked yesterday a little bit about also people don't know necessarily that these options are available for them. So I think that if you are promoting these better healthcare outcomes and you're showing that you're capable of producing them, then more people will be, and more clinicians, not just patients, will be able to harness all of this information and utilize it. And I'll pass it to you for more.
I think where we are heading is that the digital health tools and technologies and emerging technologies which are coming up, they are adding value to the patient and the physician and the whole 5P ecosystem. So what I mean by that is that in a healthcare ecosystem, there's the patient with the first P, providers, second P, payers who pay for the third P, and then the pharma is the fourth P, and the fifth P is the partners, all the devices, the labs, the imaging. So if you think about all these 5P ecosystems, they are actually today siloed, and their systems are optimized to best do that service they provide. However, the patient is stuck in the middle. So what digital health is doing now is breaking those walls, or those 5Ps, becoming consolidated, trying to bring them all down so that the data from all these various areas are now available to the doctors who are caring for them in primary, secondary, and tertiary, as well as all the care coordinators, such as the therapists and the pharmacists and the other folks who are coming home for elderly care to give therapy. It gives them all the complete, I would say, comprehensive, historical, longitudinal patient record, if I want to put it in a nicer way. So history tells an elderly patient who's at home, multiple chronic vitals has to be monitored, whether for a specific condition or for the other conditions which may exist. So I think that what digital health is doing is now bringing those old new emerging technologies and making it available to the physicians and all the 5P stakeholders. I think we're just scratching the surface. In the VR you mentioned, VR therapy for physical therapy, VR and AR physical therapy now. Today you could wear a VR headset, and as you do the therapy, the physical therapist could actually be with you virtually in the VR, in the Web 3.0 world, where they can actually see the range of movement accurately. Usually the physical therapists measure you with a little, physical device, but in the wearable world with the VR headset and the handset, as they do the therapy, physical therapy for the back or whatever condition, those data is fully available. So I think that's what is going to change, I would say, the full 360 view of the patient.
I would love to add to that. I think that as well, so we focus not only on, of course, it's very important to have physical rehabilitation, but that I feel is pretty well dealt with. We focus really on cognitive complaints, which affect people's activities of daily life, their quality of life, feeling like they are capable of doing things that they were once capable of doing, but are now no longer. There's about 420 million individuals that are living with the consequences of a brain injury and have cognitive problems. So if we're capable of treating these individuals now with digital health, then we're saving resources. We're creating the opportunity for things that weren't formerly possible. And if you look at what's happening now with these individuals, about 1 in 10 of them are receiving some type of cognitive care, leading to a deficit of $400 billion in our economy. So this trickles down, so it's not only the high care costs, but also the inability for these individuals to return to their daily lives and be productive members of society. So what we're doing with these types of interventions, this digital care, utilizing AI, utilizing data, is we're actually being able to utilize our resources in a much more friendly and comprehensive manner to treat perhaps ailments that aren't even being treated. About 1 in 10 individuals actually receive the proper treatment that they need after experiencing a brain injury.
Yeah,
Absolutely. And to add to that, so definitely remote monitoring is the future, and that is now, and that's something that's now currently being utilized in underserved populations, for example, or remote areas where they don't have access to some of the healthcare workers that would have that expertise. So digital medicine and AI and different tools can definitely facilitate and allow the providers to remotely manage patients. And I think the future is that we can all be managed remotely if we have chronic conditions, asthma, diabetes, or any other chronic condition, cancer, that many times you should hopefully be able to be monitored at home until you absolutely need to be in the hospital system. And I think one of the reasons that I got involved in human factors was to reduce error. And as we know, medical errors are the third leading cause of death in this country. So wouldn't it be great to be able to remotely manage most people and empower the patient to be able to be a part of their own care so that they're less vulnerable to being in a hospital system or a hospital setting where they then may be at risk for medical or medication error. So I think the future is now, and remote care is where we're going to go with VR and with digital medicine.
Yeah, I would add two more things. Software as an MD, you will hear the terms coming up, SOMD. Mm-hmm. Basically what that is that with all the historical information available through the consolidation of the 5 Ps, the AI now is able to pick, including the genome data, including the genetics, and including the social determinants of the health, because 80% of one's health is not on medicine within doctors. 80% of the health is your genetics and what you do, social determinant of the health. The 20% is where it comes from treatment and post-acute and pharma and others. So if you think about it, the adding the component, what is in the future is software MD, software as a solution. Once we have all the data, that can actually triage and help the patients, and then digital therapeutics. Because once you have the genotypes and gene data, genetic data into the healthcare baseline, you can see certain triggers which could cause that, and then proactively help somebody to get worse or even get that disease to intervene that, right? Yeah. That's the future, basically. Software as a solution, and then digital therapeutics, remote patient monitoring to summarize it, and then the 5P consolidation, and then the digital health driving the change. I think that's
absolutely. And I think you're not really taking the power away from the physicians in any way, because this is all really just clinical decision support. But at the end of the day, the clinician is the one that has to pull all that information together and make those decisions. But what it does is it just frees them up to be able to do that important work, so that they're well rested, they're able to maybe help more patients, and also utilize their skill set at the highest level that their training allows, so that they're not dealing with some of the things that a machine, for example, can compile and put together for them.
Absolutely. If you take our software, so we are a SaaS company as well, right?
Yep.
And if you take our software and you think about the way that patients are being treated in this whole heterogeneous population, when we collect healthy data from individuals of all different demographics and all different things, such as you were mentioning, different profiles of genetics and epidemiology and all of these things that might be incredibly important but might not be taken into account, then you can also start creating, and that's where I really see the future is going, AI diagnostic tools. Because there's a lot of human error, as you were mentioning. And there's human error in the programming of AI as well, of course. But when we collect data from thousands and thousands of individuals, we can be somewhat certain with these data analytics and machine learning properties that we're actually understanding how far from the norm is a patient deviating, and then focus on treating those specific areas. So one patient may have a lot of problems with their visuospatial skills and aren't able to navigate around, to cook a meal even, or to dress themselves. And a lot of other people may have trouble with their memory, so they might not remember their appointments. But we don't know that unless we have these comprehensive AI models that are taking all that data, like I said, 10,000 data points a minute, and concatenating that to a place that we can compare it to the normative data of healthy individuals and hope to get them back to that healthy state too.
Yeah, I think we're just about wrapping up on the time fine. So
Yes, we
if there's
are.
any questions from the...
Might we have any questions?
Any questions from the audience?
I think the audience is
Moderated from the
Yeah.
chair.
we're just going to follow up on another session. I was asked to join this as a panelist because a couple of the folks couldn't make it here. But the next session, we're going to talk mainly about digital health, telehealth, and how that drives the value-based care and the primary care section. So actually, that'll be a very good, nice segue into the next section. So I'll be moderating that. So
Thank you so much. It was wonderful being a part of this session, and looking forward to your next session.
Thank you very much, guys.
Oh, there's a question, I believe. Please.
Yes.
I wanted to ask you a question if any of you have had experience working with predictive models to sort of sharpen the knife, if you will.
Oh, yes, absolutely. We've tested some of those predictive models, and as you mentioned, and they're quite helpful and accurate. And like I mentioned, it's clinical decision support. So it gathers all of the data, and it gives you a model of, well, this scenario could happen, or this percentage of this scenario could then happen. And then the clinician then takes that information and makes the decision of which way they might want to go in terms of treatment, which treatment they want to choose. So in cancer treatment, for example, the predictive models are extremely helpful.
Yeah, in some of the predictive models, it's also helpful to incorporate social determinants data.
Yes.
Absolutely.
And in the study that the Parkland Center Clinical Innovation did on readmission for congestive heart failure that was published, if you look at that study carefully, the biggest contributor to the outcome that they had in the social determinants media was very simple: number of address changes in the last year. We've tested that model in both preterm birth and asthma, and it also holds there, so it seems to cross multiple innovations. If you're dealing with Medicaid gaps in Medicaid enrollment, increases bad results by about 50%. And then the last one is looking in the managed care models about who picks a PCP and who doesn't.
Yeah.
If they are auto-assigned, they have much higher rates of adverse outcomes.
I would love
Thank
to.
you. Thank you.
Excellent.
Hold on. Thank you so much for that. We
We
are
have to
at
stop.
time, so thank you guys so much for your time and your attention. And if you'd like to ask us any individual questions, please, we'll be around. Thank you.
Thank you so
Thank you.
much. All right.